Welcome to Kindly Neurodivergent with Kay. This show is to spend quality time with each other, kindly discussing the similarities and wide range of differences we experience. The experiences we discuss on this show are for educational purposes only. Please do not substitute for professional medical advice, diagnosis, or treatment. Today, Dr. Kutch is here with me. He is here to discuss what causes cavities, why some people get them, and how to prevent decay. Dr. Kutch earned his DMD from Oregon Health Sciences University in 1979 and built a distinguished 40-year dental career marked by innovation, leadership, and mentorship. A pioneer in laser dentistry and minimally invasive techniques, he founded 7 dental companies, secured 17 patents, authored hundreds of articles and 5 books, and lectured internationally. After retiring from clinical practice in 2019, he focused on leading oral biotech, serving as scientific advisor for dental caries at the Coy Center, reviewing for leading dental journals, and hosting the chart-topping podcast Contrary to Ordinary. He continues to teach, write, invent, and mentor, while enjoying life in Salem, Oregon, with his wife, Dana, their children, and grandchildren. Welcome, Dr. Kutch.
Hey, thank you, Kayla. It's an honor to be here. Honestly, I'm looking forward to this.
Please introduce yourself.
Okay, so I'm Kim Cooch. I know your communicator pronounced my name Kutch, but that's okay. I'm used to that. Um, and that was a pretty good summary of my life. I've I listened to all that stuff, and I'm going to be 71, and it's kind of a blur really when you look back, on all of it, and I think, wow, did I do all that? And yet I know I did. But it's been so rewarding, and I've had such a great career. I've had the opportunity to meet so many amazing people and touch people's lives and make a difference. And that I think that's the greatest reward in life is being able to make a difference in somebody else's life.
What is a cavity, and how does it develop?
So, let me back up, okay, just from that perspective for a second and say, so cavities, as we, the public, we think about, oh, you got a cavity. Well, it's a hole in a tooth. And that's actually the result of a disease process that professionally we call dental caries. Um, and dental caries, as I was being educated and trained, was a cavity, for all intents and purposes. Like if you had dental caries, you had a cavity in a tooth. And I was taught how to fix that. And I would pick up a needle and a drill, later a laser, later other technologies that I developed. And I would repair that hole in the tooth. And if the hole is big enough, sometimes you had to place a crown on it. And, we were involved in restoring that tooth so that it could function, right? Um, and what I came to appreciate about 25 years ago was that dental caries is a disease process, and it's not just a hole in a tooth, it's actually a whole body disease. And it's really a function of the environment in your mouth. And so, what we've been doing, traditionally in dentistry was fixing the hole and not treating the cause that caused the hole, right? And so people kept getting cavities. And I'm embarrassed to say, it took me about 20 years of my career to realize that's stupid. Like it's not working. If what I was trained to do worked, people would stop getting cavities, and they didn't. And so that really put me on the road to research what causes cavities and how can we fix that so that people stop getting cavities.
Interesting.
Yeah. So the cavity, that whole process is all about pH. And our body is very pH driven in terms of digesting food. You just think about different areas of the body and the pH that's required for us to sustain life, right? In the mouth, we have protective mechanisms that our saliva, particularly, that keep the pH alkaline or slightly alkaline, so that our teeth don't dissolve. Uh, Without that, being bathed continuously in saliva that's alkaline and with the mineral that the teeth are actually made out of, we wouldn't have teeth. And so when you get out of balance on that pH and you have the biofilm in a particular spot that becomes mature and is there for a long period of time, the acid from their metabolism starts to dissolve a hole in the enamel. And once they get the hole in the enamel, they invade the tooth and you have a cavity. It's as simple as that.
I have a lot of saliva.
You're lucky. Yeah, the saliva is the protective mechanism in the body for your teeth. And you think about it, one of my mentors said, we have these almost artificial hypermineralized structures that we call teeth. And the way the body maintains them is by keeping them in a supersaturated solution of the mineral that they're made out of. And so having a lot of saliva is a very good thing.
Why do some people like me have a lot of saliva?
That's a good question. Um, I don't know the answer to that question, right? Some people have a lot, some people have kind of a normal amount where we get into trouble with cavities. So I assume right now, and I don't know, okay, but I assume you probably haven't had very many cavities in your life. Yeah, yeah, you're lucky, right? Zero. You're telling me zero. Yeah, that's awesome. Um, But I was going to say where we get into trouble is when we don't have enough saliva. And that kind of throws that pH balance out of whack. And then it puts people at risk for cavities. And the number one reason for having a dry mouth and not enough saliva is taking prescription medications. So the number one side effect from most prescription medications is a dry mouth. And that puts you at greater risk then for getting cavities. And 70% of Americans take at least one prescription medication per day. 20% take, or 50% take two or more, and 20% take five or more. And so you kind of compound that problem and you reduce the saliva, and it's why we see so much decay today. And then it's not just saliva, it's also diet and home care, and some genetics plays a role as well.
Knock on wood, because I would have to be sedated.
Yeah. Yeah. Yeah, you would have to be sedated, right? And particularly not, the swallowing difficulties and things that you have, it would be very challenging to do restorative dentistry for you. It can be done, but let's keep the good saliva and keep a good diet and yeah, and keep that beautiful smile, okay?
How do foods and drinks, especially sugars and starches, affect teeth?
Yeah, so that's one of the other issues, is one of the major risk factors. And um, here's the data. The average American eats 23 teaspoons of sugar per day. I mean, that's just amazing. And we're number one in the world at consumption of high fructose corn syrup at 51 pounds per person per year. And to put that in perspective for you, Mexico is number two at 32 pounds per year per person. So that amount of sugar shifts uh, the pH in the mouth, and that pH then selects for the wrong microbes in the biofilm and all the bad players that cause cavities, and also creates behavior where the metabolism of the biofilm produces acid, and so you end up with that dietary issue, and we have a real problem in our diet. I mean, it's
Mm.
out of control.
I love sugar.
Doesn't doesn't everybody, Kay? And that's really interesting when you look at it. Sure, it's a more pleasure center in the brain than cocaine. Studies they've done with rats, actually rats choose when they're given the choice between sugar and cocaine, choose sugar. You know,
Oh.
yeah. So it's like sugar is probably the most addictive thing um, that that we have. Um, and the challenge is that 200 years ago, for us to living today, contemporarily, the challenge is, like 200 years ago, sugar was a real luxury item. Like consumption of sugar was less than 5 pounds per person per year, and you couldn't afford it. It was very expensive, and it was for the rich and famous, and so we didn't really have a lot of those refined carbohydrates in our diet. Today, sugar is cheap, particularly fructose, corn sugar is cheaper than cane sugar, and so that's why that kind of got introduced in our food supply in the early 1980s, and that's been a real challenge for us. Our bodies don't really metabolize fructose well. And so it ends up being deposited, it causes fatty acid liver disease, it adipose fat. So it's one of the challenges, I think, one of the great health crisis challenges that we have. But yeah, I mean, I'm hopeful that um, the decay problem that we have in the United States is driven primarily from two things. One is prescription medications, and number two is the amount of sugar that we eat and consume. And it's funny, I think there's 56 names for sugar. And with that are allowed with the FDA, and so it's quite clever. They'll list the ingredients on the bag and or the package, and one of them is one of them I saw a couple years ago in a study, and it said it described it as rapidly digestible starch, and I thought, wow, that's an interesting term. I wonder what that was, and then I got to look at it, and it's like, oh, it's sugar, right? And so
Mm.
um, we get sugar and hidden sugars in our food supply just all the time. It's important to read packages, but those are the two major things that are causing um, most of the decay that we experience in the United States today.
More popular than weed too, right?
I'm repeat that one. More popular than.
More popular than weed too, right?
Yeah, I didn't catch that one.
Weed.
Oh, right. Oh, yeah, absolutely. Yeah, yeah, yeah. More popular than weed. Yeah, for sure. Uh,
Mm.
yeah, I mean, it's in everything. I mean, it's the treat. It used to be a treat, and now it's like in all of our foods. And the reason it's in our foods is because it's addictive. How do I get somebody to eat more of this and buy more of it? Put sugar in it. Put sugar and caffeine in it, and for sure, people are going to buy more and eat more, right? So, Kayla, I have to tell you something. So, being a dentist for 42 years, chairside, one of the hazards, occupational hazards in dentistry is because of the noise from the high-speed drill and the suction, is that we all end up with high-frequency hearing loss. And so most old dentists, so here we sit, you and I have a disability, with hearing loss, and you're using an AAC. So it's a great challenge between the two of us, but I think we're doing pretty well if you ask me.
Mm.
How early in life can cavities start showing up?
They can start as soon as the first teeth erupt, and typically that's about age 4 to 6 months. However, what's interesting is the microbes, the biofilm that causes those cavities, can be transferred from the mother or the primary caregiver, it may not always be the mother, to the child. We used to think that you didn't get those kind of bugs in your mouth until you had teeth. And now we know that actually gets transferred like the first day of life, right? You start developing your microbes, your biofilm in your body, like at birth, actually going through the birth canal. So you could end up with the bad biofilm that causes cavities before even the first tooth erupts. So, to take that answer, you can get cavities as soon as you have teeth.
You know why?
And we know why. Yeah. And it's really that it comes back to that. It always comes back, Kay, to the pH balance. So it's like nursing is good for a child, like, nursing is great, but nursing at will is not. We also know that if you eat milk has sugar and has lactose, and if you eat like nurse 3 times a day, that's fine. If you nurse every half hour, you continually get this that sugar in your mouth, and you could end up getting cavities from nursing, right? Or if you have a bottle with milk in it and you have a bottle like at will, like all day long. And so it's just not the amount of sugar, it's how frequently you eat as well. Every time you eat, the pH in your mouth drops, and your saliva and other protective organisms in the mouth and that biofilm raise the pH back up. It takes about 30 minutes to happen. So every time you eat, your enamel starts to dissolve, and 30 minutes later, it recovers. And that dynamic goes on like every day, all day, right? As you eat. So
Wow.
the important thing is to allow your mouth to have time to recover. And if you don't have enough saliva, let's say you're taking 2 or 3 prescription medications, they're not lucky like you who has a lot of saliva. They don't have enough saliva. It takes longer than 30 minutes to recover. And research has shown if you just snack 2 times a day in between meals, it increases your risk for getting cavities. Just 2 snacks a day in addition to your 3 meals. And Americans today, we're grazers. We eat like all day long. We snack. The days of the 3 separated meals and sitting around the family dinner table at night are kind of.
What if it is a healthy snack?
What is a healthy snack? um, you know, oh, one.
What if it is a healthy snack?
Okay, what if it was a healthy snack? Okay, so here's a challenge, right? And every time you eat, it doesn't matter what you eat, the pH drops, right? So some snacks are healthier than others, like let's say vegetables or like celery or carrots or something like that are a healthier snack than say a bag of M&Ms, right? Like we get that. Like that's pretty obvious, right? However, the challenge is the pH drops even when you're eating those foods. So you still need to give your mouth, kind of a chance to recover. Best thing you can do after you snack, if you're going to snack, and of course we all are, is to rinse your mouth out with tap water. Tap water, it tends to be close to neutral. A lot of bottled waters, a lot of bottled waters have a pH of 4.0, which is very acidic. And the reason they have that is for shelf life stability. So, they take the chlorine and everything else, they put it, they want to bottle the water and keep it safe. The way they do that is they acidify it. So again, drinking acidified water puts the pH in your mouth out of balance and can contribute to that whole decay process too.
Do they list the pH?
The pH, yeah, they list. Actually, you can just do like a search, a Google search, or now it's any of the AI programs. You can just do a search and ask for the pH of bottled waters by brand, and they will give you an entire list so you know which ones are acidic. And there's quite a few that are now a pH of 7 or above, and even some alkaline waters that you can buy. So, but tap water, is the easiest, simplest thing to do. Just rinse your mouth out with tap water, help get the pH kind of to recover. And then give your mouth an opportunity to recover, right? Like, wait 30 minutes before you snack again or whatever. Where we get into problems is where people just continually kind of snack like all day long and their mouth never really gets to recover. And that really tips the scales on the pH and really puts you at risk for getting cavities. And then particularly if it's not a healthy snack, right?
Mm-hmm.
Hmm.
Why do some people get frequent cavities even if they brush daily?
And again, that comes back to their saliva, the amount of saliva they have, and their diet. Like, how much sugar are they eating? How frequently are they eating? We used to think, Kay, that as dentists, we would tell patients brush and floss, right? This is a biofilm disease, and you're not going to fix it with a brush and a piece of string. I mean, it's not, if it were that simple, people that brush and floss wouldn't get cavities. And it's not that simple.
Does anything help get more saliva?
Um, Oh, I mean, there's some drugs that will increase saliva flow that you can take, but it's just a short-term kind of temporary effect with it. You can stimulate saliva flow by chewing. So chewing like xylitol gum will help stimulate some saliva flow. But basically, if your biology is what it is, right? Your body, and then depending upon if you're taking prescription medications, your saliva, and particularly the hardest challenges I treated a lot of patients who had post-cancer, radiation therapy, head and neck cancers. That really destroys the salivary glands, and that becomes a real challenge for people. And so one of the things I developed was a mouth spray, which actually has a lubricating agent in it, has a pH of 9.0, and helps buffer the mouth so that for people that experience a really dry mouth, they can take a couple of squirts of that mouth spray, and that really helps them. Yeah, that's in my my company called Carry Free.
How might medications or health conditions common in neurodivergent people affect risk?
Yeah, so if you're taking, yeah, I mean, if you're taking medications, neurodivergent people, if you're taking drugs for ADHD or autism or et cetera, right? All of those drugs, and particularly the anti-anxiety medications, tend to be some of the most impactful on the saliva. And so, literally of all the prescription medications, all of them, the number one side effect is dry mouth. And the more medications that you take, like the greater the combinations, the more, um, the more it dries your mouth out and the greater the risk. We have 17 million adolescents in the United States who are on psychotropic drugs for depression, ADHD, et cetera, autism, et cetera. And, that's why I think it's one of the reasons, contributing factors of why we see so much decay today.
Does any medication not?
Does any medication not? Um, yeah, there's a handful, but primarily it's a real typical side effect from medication. So one of the questions I ask patients always is what medications are you taking and how many, so that I can kind of figure out if that's one of the contributing factors. Now, obviously, as a dentist, I have a patient that's taking, let's say, 3 or 4 medications, and they've got some cavities. I can't take them off their medications, right? But what I can do is help them understand how important their diet and their saliva is going to be to stop getting cavities, right? So that it's like you really need to focus on not snacking, eating a healthy, functional diet, and having very good home care, and keeping your mouth hydrated, right? With, like I say, with a neutral or alkaline water throughout the day, maybe an accessory spray. Um, Maybe chewing xylitol gum and you feel like you have a dry mouth. Those kind of things can help alleviate that. But it can't, that's one of the challenges is if you're taking a lot of medications or even one medication and it's putting you at risk, I just need to figure out what the other risk factors are and help you mitigate those so that, we can help control it. And all the patients that I treated,
What?
I was able to help.
What if it is not an oral medication?
What if it's not an oral medication? Like maybe an injectable or something like that, um, they still have they still have that side effect. Yeah. What I don't know is like the new GLP-1 drugs that we're using for obesity. I haven't those really came out since I was practicing, and so I really haven't looked into are they contributing to dry mouth or not. But you know, literally that's the number one side effect from medications. You're asking some great
What
questions.
about sensory or motor differences that make brushing and flossing hard?
Yep, that's a challenge, right? And motor skills are, as you know better than anybody, right? Those fine motor skills to be able to floss, be able to brush, and brush effectively. So electric toothbrushes help a lot, right? Yeah, yeah, I figured you're using one. And water flossers. Like instead of trying to use a piece of string, water flossers are very effective. Getting food and particles out from between your teeth and removing plaque as well. So those are easier. And sometimes it takes help from a helper, right? From other people to help as well. So yeah, so that becomes a challenge, and particularly a lot of older patients, that I treated, our aging population in the U.S. having a harder time with motor skills, maybe have had a stroke, et cetera. And so then it becomes very important to make sure that, again, they're probably on medications at that age. And diet is very important, become very critical then at that point also, and then making sure that they're getting adequate home care, either able to provide it for themselves or have an aide or somebody that helps them. Yeah.
What about toothpaste?
What about toothpaste? Uh, that's a great question. So, Kay, one of the things that sent me on my journey here almost 25 years ago, I got my head around some science from one of the world's, most respected researchers in our field in dentistry, Dr. Philip Marsh at Leeds University in the UK. Philip is retired now, but it was the birth, it's interesting, it was the birth of the internet 25 years ago, really. And suddenly I had access to all the best minds in the world when it came to tooth decay, right? Like literally, I could email these experts and ask them questions. And so and literally every single one of them responded to me and helped me and mentored me. And I was so fortunate and so thankful. But Philip Morris particularly did research back in the 1980s that demonstrated that it was not the sugar, but it was actually the pH that caused the change in the mouth in the biofilm that caused cavities. So I kept going back to his research and I thought, if this is right, if his research is correct, then what I need to do is treat the pH and see what happens. And so I built a number of companies, like you pointed out. I still had my own scientific laboratory. So I went to my lab, I went to Walmart, I bought every toothpaste on the shelf. I bought every one. I thought, I'm going to figure out which one has the highest pH, and I'm going to have my patients use that. I'm going to see what happens, right? Because if the pH causes this, maybe I can correct it with pH. And Dr. Mars assured me that that actually would work. Well, to my great surprise, I had no clue. All the toothpaste that I tested were acidic. And a lot of them were in the pH of like 4, which is below the critical pH of enamel. Enamel starts to dissolve at a pH of 5.5. And I had no clue. I mean, I've been a dentist for over 20 years and I had no idea that that was the case, or mouth rinses, et cetera. And so that put me on the journey of I realized I was going to have to create an alkaline product and test that. And then I discovered why products aren't alkaline. Because at a pH of 4, nothing wants to grow in it. You have shelf life stability. And at a pH of 8 or 9, everything wants to grow in it. And so that's a challenge for shelf life stability. And so it took me and a team of engineers 4 years to figure out how to get shelf life stability out of an oral care product that had a pH of 8 or 9 or even 10. And so we figured that out. We patented it, and at the time, and I started treating patients, and it immediately made a difference for them. They stopped getting cavities, the patients that I had that were using it. So altering and raising the pH and buffering and maintaining a healthy pH in your mouth will correct the biofilm. It'll correct the problem that caused the cavities. Now, it's not going to overcome 6 Mountain Dews a day, right? You can't eat M&Ms all day, right? It has limits, but within reason, having an alkaline pH, creating that environment in your mouth helps correct the biofilm and actually helps prevent cavities. And so I started a company to create those products, and that company is Oral Biotech, and it's here in Albany, Oregon, and the product name is Carry Free. And, so we have toothpaste for kids, remineralizing toothpaste, anti-cavity toothpaste, toothpaste with fluoride, toothpaste without fluoride, but they're all alkaline. And so they all provide the same function of raising that pH and helping maintain a healthy environment in the mouth to keep you from getting cavities. And it works.
Does swallowing toothpaste have like cavities?
Would you do that one again?
Does swallowing toothpaste have like cavities?
Oh man, Kayla, I didn't understand it. I'm listening very close.
Does swallowing toothpaste have like cavities?
Does sell, selling toothpaste? Oh, swallowing toothpaste. Got it. Does swallowing toothpaste prevent cavities or cause cavities?
Have like cavities?
Uh, Swallowing toothpaste is not a good idea. Let's put it that way. You don't swallow enough. So here's the question, okay, and this is a really, I think, an important question for right now. Because the fluoride is a hot topic, and I know you're aware of that, right? RFK Jr., head of HHS, wants to take fluoride out of all the drinking water. Utah is the first state that actually has banned fluoride in water. Now Florida has. A number of states are going to probably follow that. And so there are some systemic risks with swallowing fluoride. Like we know it interferes with TSH and T3 thyroid hormones, right? It interrupts them. At very high levels, it does create an issue with neuronal development, particularly in young children, but we're talking about very high levels of fluoride. Not the levels that we typically use in drinking water. However, here's the thought. By just using fluoride, if you want to have fluoride and the benefit of it, it makes your enamel more resistant to decay. It helps it remineralize, it helps do those things. But just applying it topically in a toothpaste and spitting the toothpaste out and not swallowing it, or even swallowing just a tiny amount, the question that I asked was, what is the systemic exposure of using a fluoride toothpaste, right? You're not taking fluoride in the water. You're not taking a fluoride tablet. You're not doing that. What is the exposure? And it really has not been studied, believe it or not. And so I conducted a study in June this summer of 20 people, adults and children, and I put them on a non-fluoridated toothpaste for 2 weeks. The half-life of fluoride in that once it's in the body is only 20 hours. So in 2 weeks, whatever fluoride was from their oral health care product was gone. So I tested their fluoride level and we used urine. That was an easy one to, I've got a fluoride probe. I got urine samples from these patients. They were all willing to do that. And then I put them on a standard fluoride toothpaste for 2 weeks, so one of our products. And then I measured the fluoride level again. And interestingly enough, there was no statistical difference between before and after. And so I can tell you, based on a small study of 20 people, a preliminary study, it appears that there's negligible exposure, systemic exposure to fluoride when you use it just as an oral healthcare product. Now, if you're hypothyroid and you already have those issues, I would say probably best to filter your drinking water and also not use a fluoridated toothpaste, right? Because we do know that it does interfere with those hormones. Just to be on the safest side. But I think that's a very important question, a question to ask. And as we get our head around, people that want the benefit of fluoride and are worried about any systemic risk. Now, here's something that most people don't know. Fluoride is naturally in the ground, so it ends up in just about everything you eat and drink, and at very high levels, like coffee and tea. Tea has a fluoride level of like 3 to 4 parts per million naturally. So if you're drinking black tea, you're drinking fluoridated solution that's 4 or 5 times higher than fluoridated water that's coming out of your tap. Seafoods, shrimp, but all foods, grains, meal, you just go down the list. There's fluoride literally in almost everything you eat and drink. And so, for the patient that says, Doc, I don't want any fluoride, well, you're going to have to stop eating and drinking because, right? Because it's literally, you almost cannot avoid fluoride at some level. So that's kind of a topic that nobody talks about or maybe isn't aware of. So, is there a safe level of fluoride? We haven't established that in terms of a health-based value. That hasn't been sorted out yet. So anyway, it's a pretty hot topic in my profession right at the moment, and I think it's on the minds of a lot of people.
And cavities stop on their own if you improve your brushing?
Can they start on your own if you improve your brushing? They still can. So even maintaining like perfect plaque control, theoretically, if you're eating the wrong foods, you don't have a good diet, and you don't have enough saliva, you're still going to get cavities. I have one patient that, her teeth were spotless, and she was getting 2 new cavities per year when her dentist referred her to me. I know, right? And Kayla, she had literally, her teeth were spotless clean. And I said, well, what did the dentist, and your hygienist tell you? And they said, well, they said I needed to brush and floss better to stop getting cavities. And I looked at her, I said, it's not possible to brush and floss better than you're flossing and brushing. And as we got through her medical history, she was taking anti-anxiety and depression medications. She had almost no saliva. And so once we worked through that process, helped her understand how to hydrate her mouth, got her on alkaline oral healthcare products, and helped her understand her diet, she became decay free. And doing that, just doing that simple thing changed it. It wasn't about the brush and the floss. So it's more, when I said it's more than that, like you can't treat this disease with a brush and a piece of string. It's a multifactorial disease, and it's a biofilm disease. And so we really need to fix the biofilm. That's a great question, by the way.
Thank you, Dr. Kutch, for doing this with me. It was great to have you on. Please share this talk show with your family, friends, clients, and colleagues. Everyone watching, don't forget to like, follow, subscribe and share on Facebook, Instagram, and YouTube.